ETOP NICOLAS trial is a safety trial by nature. The idea was to look at the opportunity and feasibility of giving immunotherapy in stage 3 disease concurrently to the standard of care. So starting the immunotherapy in the same time of the radiation and the chemotherapy. So everything piled up. What we know from Pacific is you can give immunotherapy after you have given the standard of care. NICOLAS is shifting that and gives the immunotherapy from the very beginning with chemo, with radiation. What was the concern? The risk of pneumonitis. Radiation gives rise to pneumonitis and immunotherapy gives rise to pneumonitis. Would it have been cumulative or dangerous for the patient in terms of increasing this prevalence? So the endpoint of NICOLAS was high-grade pneumonitis, the incidence prevalence of high-grade pneumonitis. We didn't observe any increase of pneumonitis as compared to the expected rates, meaning that this is highly feasible to give radical ablative radiation plus chemo plus NIvolumab without any unexpected toxicity, short-term and long-term. And here we disclosed, for the information of all the colleagues, the efficacy outcome. Secondary endpoint and primary endpoint was safety. And we were able to show that half of these patients are still progression-free at 1 year, with a median progression-free survival of 20.7 months at the time being in NICOLAS. Very favorable to all the other trials with the same type of design where the patients are enrolled at the very beginning of the treatment. So Pacific was a bit later. So it's a favorable outcome as compared to other previous trials, and the overall survival is still in evaluation, but a very nice overall survival also too of 30 months in NICOLAS. So basically it's feasible. Phase 3 trial will also adopt this strategy, and the outcome looks like being favorable in terms of trying to cure a bit more of these patients.